you. My name is Calif Musa, a trained clinical nutritionist, and I welcome you to the homestretch edition of Changing the Tides Against Non-Communicable Diseases. We are honored to be at African International Technical College grounds to bring you this informative episode, which will mark a wrap-up of the series that we've been having in the previous week. I am joined on my right by Madam Kanda, who I will let or give way so that she introduces herself.
Good afternoon. Hello viewers. Welcome to today's episode. My name is Kanda Immaculate. I am a clinical officer by profession, and you are welcome to this session. I hope you will get something positive out of it. Welcome.
Also to recognize is our students on my right and left side from this institution taking various health courses. And today, in the aspect of changing the tide against these non-communicable diseases, we'll be focusing on ischemic heart disease. But before we get to the detail and further discussion of whatever that we're supposed to handle today, we thank the viewers for their positive contribution and responses in the previous episodes that we have. If you remember, the first episode we talked about diabetes, and in the second episode we talked about hypertension. And there are various questions which arose from that, which I think it is very important that we respond to before we proceed to the next chapter of the discussion. And Madam Kanda, just one of the questions that came up from our viewers was that why are we focusing so much on non-communicable diseases?
So thank you, Calif. When you say non-communicable diseases, they are diseases that cannot be transmitted from one person to another. And on the other side, we have what you call infectious diseases. Infectious diseases can be transmitted from one person to another. An example of an infectious disease includes TB. An example of a non-communicable diseases, they are hypertension, diabetes, heart failure, and other diseases. So the reason why you are focusing on non-communicable diseases is that non-communicable diseases, most of them doesn't present with symptoms at the early stages. By the time someone is diagnosed with non-communicable diseases, be it diabetes, be it hypertension, it is at their complication stage or so. And then one thing, in the past, infectious diseases were at a higher percentage as compared to non-communicable diseases. But now, in the current era, non-communicable diseases are at a higher percentage. Reason being urbanization. Others also could be the sedentary lifestyles of people. And then another thing why we focus on non-communicable diseases is that 25 to 50% of hospital admissions are due to non-communicable diseases. So it is a call to action to us that we have to take the necessary steps, one of it being education and that or stroke creating awareness, and this is what we are doing. Yeah.
Thank you very much, Madam Kanda, for what you've said. And from whatever that you've communicated, I've picked that one of the reasons as to why we as medical professionals, we are focusing on these non-communicable diseases is because we're having a rise in the number of morbidity and mortality rates in regards to non-communicable diseases. If you look at the numbers given by the WHO in terms of statistical figures, you realize that these non-communicable diseases actually cause a high number of deaths globally. An example of whatever that we are looking at today is ischemic heart disease, and from whatever that I've gotten from my own online search is that this disease is responsible for around 8.9 million deaths globally in 1 year. So our viewers, that is one of the reasons as to why we are focusing on non-communicable diseases. As she had said, number one is that it is basically a silent disease, and you may not know that you have this disease until the symptoms begin to appear. And once the symptoms begin to appear, then you are at the advanced stages of these kind of infections or diseases. Another important question that came out of that engagement with our fans and viewers on the media platforms is that are we able to reverse type 2 diabetes and hypertension? Is it reversible? Do we have any medical literature detailing on whether these conditions are reversible or not?
So type 2 diabetes mostly occurs due to the lifestyle that we live in. So it's something that we can really prevent by changing our lifestyles. So we have what we call risk factors. When we change the risk factors, also, when we live a healthy lifestyle, we can easily prevent them. That is why even we focus on the non-communicable diseases, because it is something that you can prevent before it progresses to its complication stage. Maybe you can add another point on that.
Yes, I would like to add a point on the reversibility or the remission of type 2 diabetes or hypertension. What we have currently in the literature that we have is that we are seeing that there are efforts towards actually patients coming into remission from such infections. There's a study that I found online, and it was basically structured on ensuring that these patients are strictly on a diet, on a caloric deficit diet. So whatever that the study found out was that after some time, some of the patients who are diabetic and hypertensive, they were into remission. So, Madam Kanda, a very important aspect and a very important question. We mentioned weight loss or obesity and overweight as one of the important risk factors that actually leads to the development of certain non-communicable diseases. And in this online engagement, somebody mentioned a drug called Ozempic, which has been rigorously used in the loss of weight. Do we have any potential side effects, or how could you advise our viewers in regard to the use of this drug for weight loss or weight management?
Okay, yes, asante Mr. Calif. So Ozempic is a brand name, but the generic name of that drug inaitwa semaglutide. So hii dawa inatumika kwa individuals with type 2 diabetes, inawasaidia kwa weight loss. But you come to see that there is a certain trend where watu wanatumia that semaglutide for weight loss even if they don't have that type 2 diabetes. So semaglutide you inject, itasaidia kwa weight loss apart from the physical activity that you do. So we have certain side effects. There's a way semaglutide works, so it increases the amount of insulin that is produced, so itasaidia ku lower the glucose levels, hence itasaidia kwa management of type 2 diabetes. So we have the side effect. Side effect moja ya semaglutide, kuna the less severe and then we have the most severe ones. Most severe ones ni kama thyroid tumors, and also it can lead to some form of stomach upset, or what we call kitu inaitwa stomach paralysis. And then another thing, we have pancreatitis. So the pancreas itself inaanza kuwa inflamed. Thank you.
Thank you, Madam Kanda. So basically whatever you've said is that this drug has side effects. So to our viewers back at home, I think it would be better if maybe we could stick towards the most convenient and the most safe ways of losing weight instead of using drugs as a result of, or with the intention of losing weight. Therefore, that said, I think that brings a wrap up to the discussions that we have on hypertension as well as diabetes. And today we are saying that we are focusing on ischemic heart disease. And one of the reasons as to why we are focusing on this disease today is that you realize that we have a global prevalence of this disease causing around 8.9 million deaths a year. And if you Google, ukienda kwa simu yako Google, ukaangalia the top 10 causes of death, you realize that ischemic heart disease ranks number 1. And that is why we are focusing on that in this homestretch edition, which is a wrap-up of our discussion around the non-communicable diseases. So, Madam Kanda, please, I would like you to enlighten our viewers. Tukizungumza about ischemic heart disease, what is it? So that mtu ambaye ako nyumbani, maybe this word ischemic heart disease or the coronary heart disease is very unfamiliar, but ningependa udemystify, uwaelezee wakati ana come across the term ischemic heart disease, ni issue gani, ni what condition?
So ischemic heart disease kwa jina lingine tutaita coronary artery disease. Kwa jina Kiswahili tutaita ugonjwa ya mishipa ya roho. So roho ni like a muscle. So the muscle itself, kuna artery, hiyo mishipa yenye ina supply ama inapeleka damu kwa roho. So kukiwa na any occlusion ama hiyo mishipa ikikuwa narrowed, inaacha kuwa pana vile ilikuwa, inaanza kuwa nyembamba, kumaanisha damu haiwezi kafika roho vile inafaa. So there is an imbalance between the demand supply by the heart. There's an imbalance between the demand and supply of blood to the heart.
So basically, Madam Kanda, you've said that this ischemic heart disease occurs when we have blockages in those vessels that take blood towards the heart.
Yeah.
In the heart for its own use, right? Yeah. So I think that is clear for those who didn't know what ischemic heart disease. And moving systematically, we are supposed to look at the etiological factors. Yani ni vitu gani ambazo inapelekea mtu kudevelop this ischemic heart disease, because magonjwa yote yako na root cause. And therefore, I think it is very important for us as UNK Media and this unit of addressing NCDs to angalia what are some of the etiological factors which lead to the development of such kind of diseases. Madam Kanda, I welcome you to take on.
Yeah, that. Thank you. Tukisema etiological factor, tunasema chanzo. Ni chanzo kipi kinaleta kuwepo kwa ugonjwa mishipa ya damu? So ni nini ina cause? So there is one major thing. Tumesema mishipa inaweza kuwa nyebamba kuliko venye ilikuwa, and then kunaweza kuwa na what you call occlusion, which happens kukiwa na destruction of that artery. Hiyo mshipa inaitwa coronary artery. When there is a destruction kwa that artery, ina undergo what we call inflammatory process, and then ina form a clot. That clot ina grow pole pole with time, and then by the time inakuwa big, inakuwa kubwa, so damu haiwezi ikafika roho. So I can say the main ama chanzo cha kukuwa na coronary artery disease ni either occlusion ama narrowing of the coronary artery.
Something very interesting that you've mentioned, and I would like us to interrogate it on finer details. Tunasema mambo ya occlusion, and I would like to ask, could this occlusion be caused by unhealthy diets, or could there be some kind of diseases which could cause the inflammation that we've talked about?
Yeah, very indeed. So we have what you call the risk factors. Risk factors ni kitu ambacho kidaongeza ama ina predispose somebody to get a certain disease. So for that, yenye nimesema the inflammatory process, the artery inakuwa destroyed, and there are so many factors that can cause the artery to be destroyed. Kitu ya kwanza, mtu mwenye ako na diabetes ama ugonjwa sukari, utapata kwamba their blood vessel ama mishipa yao inakuanga destroyed. There's a way mishipa yao si nzuri sana. So mishipa ikiwa destroyed, ina undergo that inflammatory process. Kuna what you call lipid, it undergoes that inflammatory process, and then the end product ama kitu cha mwisho inaitwa lipid plaque. So that plaque iko na lipid in it, and that one it prevent flow of blood iende kwa the heart. Another one, we have hypertension. Hypertension bado ina damage the blood vessels, and then it undergoes the same inflammatory process. The end product inakuwa that lipid plaque, and then which ends up obstructing blood flow to the heart. Yeah, thank you.
Thank you, Madam Kanda. And something very important that I would like to highlight. Now, wakati tunazungumzia mambo ya risk factors, as Madam Kanda said, these are conditions or factors which predisposes an individual towards developing these NCDs. And in the broader umbrella of risk factors, we have two types. We have the modifiable risk factors, then we have the non-modifiable. Hizi modifiable ni zile ambazo unaweza change. For example, an important risk factor that I can talk about as a clinical nutritionist is poor diet. Wakati una eat ama wakati unakula highly processed foods, hizi mikate ambazo ziko huku nje, chapati, the fries, the fried chicken and the rest. This kind of diet actually waga ina increase whatever that we call the LDLs, the low density lipoproteins. So wakati ina increase, it leads to whatever blockage or occlusion that Madam Kanda has talked about. Then we have the non-modifiable risk factors. For example, age. Madam Kanda, I think it would be important that we talk about these non-modifiable risk factors because we can't change. And to that effect, I think it is better to engage our audience to ambie hizi non-modifiable risk factors ni gani, so that wajue as much as tuna focus sana on the modifiable risk factors.
Asante. So vile Mr. Calif amesema, imegawiwa mara mbili. We have the non-modifiable and we have the modifiable. Ukisema non-modifiable inamaanisha uwezi fanya jambo lolote kuzuia huo ugonjwa kupate. One of the non-modifiable factor is age. So utapata those individuals, the old age, most of the time can get coronary artery disease. But pia hawa wadogo, I think as young as maybe 23 years old, they can get that coronary artery disease, but mostly inakwanga the old age. Another risk factor na modifiable one ni sex. Kama wewe ni either female ama wewe ni male. So the male at a higher risk of getting coronary artery disease. So male wanaanza kupata wakiwa around 45 years, and then the gap between the male and the female, male watapata at around 45 years, the female at around 55 years. So the male are at a higher risk of getting coronary artery disease compared to women. Women wakifika the menopause, inaanza kubalance sasa. So the risk of getting coronary artery disease inaanza kuwa at the same level as of that of men. The reason why we have women before wafike the menopause wanakuanga na hormone called the estrogen hormone. So estrogen hormone protects them from getting any form of clot. So they are not at a higher risk of getting the coronary artery disease. But wakifika menopause, that estrogen hormone is not there. Hawatakuwa na that estrogen hormone tena. So inamaanisha their risk of getting coronary artery disease inaanza kuongezeka ama inaanza kubalance na those ya wanaume.
That's a very interesting perspective that you've put out, and I hope our viewers as well as listeners all over the world are getting the points clearly. And just to wrap up on whatever that she said, when you talk about the modifiable risk factors, unaongelea sasa zile vitu ambazo unaweza badilisha. Kwa mfano, one of the risk factors that we have for this ischemic disease is a sedentary lifestyle. Mtu unakaa unakula bila kufanya mazoezi. It becomes a very important aspect that you exercise. And one of the reasons as to why unapata siku hizi watu wengi hawa exercise ni kwa sababu ya kazi. Najua kitambo watu wengi walikuwa wanafanya manual jobs. Watu wanaenda mashamba, watu wanafanya 1 to 3. So that was a form of physical exercise. But siku hizi unapata mimi kama mwalimu nakuja class nafunza kila wakati, sipati nafasi ya mazoezi. And this is something that is widespread across the employment industry. So that lack of exercise and a sedentary lifestyle, unakuja kwa ofisi, unakaa, unaenda nyumbani, unalala, unarudi the same day, then it becomes a behavior day in day out. This becomes one of the important risk factors that can lead to the development of heart disease. Another important thing that I mentioned earlier on, but I would like to insist, is unhealthy diets. Kukula highly processed foods, and basically these foods which are fried, mambo ya mkate, mambo ya chapati, na siku hizi unapata chapati kwa everywhere. Kitambo when I was young ulikuwa unapata chapati, maybe you would eat maybe wakati wa sherehe peke yake, but siku hizi you eat chapati all over. And that is why you are seeing, because we are having a shift in the dietary patterns and behaviors of individuals towards food, and also whatever that is offered as food in the supermarkets, in the hotels, all these foods, they lead to the development, or they become an important risk factor towards the developing of this ischemic disease.
Yes, so maybe something like in real life, kwa hiyo story the diet. For example, bread. We have the corporate ama any organization where they really value the employees. So maybe wanasema every morning they have to take a bread, and a bread is like a processed food, so it has like a lot of sugars. So it is a good thing, yes, but they really don't know like hapo ndio shida inaanzia.
Ni kweli. Madam Kanda has put on a very important point. Amesema ni mzuri kupatia watu chakula, but also we're supposed to look at the types of food that tunapatia watu, because you realize it doesn't make any sense that you offer food to individuals at their own detriment in the end of the day. So we should have a change in our behaviors towards food and the types of food we eat. And unfortunately, the reason as to why we are having such issues or this rise of NCDs is because watu wengi hawajui kukula. We assume that ile ambayo umefunzwa na mamako kukula tangu kuwe mdogo ndio chakula ambayo unafaa kukula. And that is why tumekuwa na these issues of NCDs rising, among them being ischemic heart disease. Another important risk factor ni mambo ya smoking, kutumia miadarati, mambo ya cigarettes, and also the unreserved consumption of alcohol. I think this becomes a very important point of discussion. Watu ambao wanakunywa pombe na watu ambao wanavuta sigara heavily. At the end of the day, after some years, mwili yako itakuwa inajaribu kucombat the effects of these behaviors. But at the end of the day, if it becomes a consistent behavior, then it predisposes you towards the development of this non-communicable disease.
So to add on your point yako ya smoking is like a major factor in causing coronary artery disease. So utapata like ina narrow the arteries ama the blood vessels, and that is where like the problem starts. Another risk factor, we have the high cholesterol levels. I think Mr. Calif ameongea about it. And then from about the diet, kama unaishi like a very sedentary lifestyle, you eat a lot of junk food, yes, which is sweet, but at the same time it can really give you a health problem. So ukikula ama you live in a sedentary lifestyle, inamaanisha it can predispose you to other diseases. For example, itakupatia diabetes, ama it can predispose you to getting that hypertension ama pressure. So kukuwa na ugonjwa sukari, kukuwa na ugonjwa ya pressure, bado inaweza kukufanya upate hii ugonjwa ya mishipa.
Yeah. And something else that Madam Kanda said, imering kwa akili yangu just now, is that this kind of disease, we say it has a multifactorial risk factor. Yani unapata these risk factors in a combine. For example, you can be inactive physically, na pia unaweza kuwa unakula chakula ambayo si healthy. So unapata wakati unakuwa na lifestyle ambayo ni sedentary, and also you are not maybe you are using those drugs and your diet is unhealthy. This becomes a very serious interplay or a combination of risk factors which basically leads. Si ati ni kitu moja peke yake that we can single out to seme that it is this that leads. It is a multifactorial interplay of these risk factors that lead to the development of this ischemic disease as well as other non-communicable diseases. So moving on, we want to talk about the pathophysiology. Na maybe in simple terms, Madam Kanda, wakati tunaongelea about pathophysiology in medical terms, because najua most of our viewers ndio kuna madaktari, maybe kuna manases, kuna CEOs, but kwa mwananchi wa kawaida tukizungumza about pathophysiology, ni nini ambayo tuna focus on sana?
Tukisema pathophysiology inaelezea of how a certain disease develops. Venye mtu anaanza kusikia ama ni nini inafanyika kwa mwili, inakuja polepole hadi mtu anaanza kupresent na hizo symptoms za coronary artery disease. So I'll just use a very simple medical description without kusema mingi sana. So earlier I'd mentioned about atherosclerosis. Your clot ama the lipid plug ndio inaitwa, the process of it inaitwa atherosclerosis. So ina harden, ikiharden inamaanisha blood haiwezi ka flow ifike kwa roho, and that's where sasa other things can occur, maybe heart attack or so. So I can just explain even in simple terms.
Okay, thank you. So our viewer pale nyumbani, leo umetajua a term, atherosclerosis, and I think Madam Kanda has put it very well. So for this ischemic heart disease, tuko na various signs and symptoms, and we said for these non-communicable diseases, sometime, not all the time, unapata that these signs and symptoms waga inapia towards the end, towards the detrimental end of things. So Madam Kanda, ni vitu gani ambazo mtu anafaa kufocus on ama angalie keenly so that haizi kujua maybe hii inaweza kuwa indication ya this disease being apparent?
So symptom ya kwanza ama naweza sema kitu cha kwanza ambacho uta experience ndio uweze kujua kama ni heart attack kama si heart attack, ni chest pain, uchungu kwa mbavu. So inakuanga central chest pain na itatoka hapa kwa the central, hapa kwa kifua iende pande nyingine ya mwili. Moja we have the jaw huku, ingine we have the shoulders, ingine inaweza kuja to the arms, mikono, sana sana the left arm. Alafu kuna another symptom that daktari ama any medical professional anaweza ona ni kama haiwezi kuwa heart attack. So mostly wengine wanaweza pata what we call epigastric pain. So ni uchungu ya tumbo hapa juu. So maybe utakuwa unaenda hospitali unaambiwa you have gastritis, uko na gastritis hivyo, but inaweza kuwa ni that heart attack inaanza kudevelop. So it's really good kama healthcare professionals that we really be keen with patients presentation. Kitu nyingine, another symptom ni sweating. Unaanza kusweat, something called diaphoresis. So unaanza kusweat kabisa, and then utaanza kushindwa kupumua ama difficulty in breathing, and then pia utaweza kukosa nguvu ya kufanya jambo ama kuweza kutembea. So hivyo. So na hiyo uchungu wa kifua utakuwa una feel ni kama inakukaza kabisa. So si uchungu ya kawaida, utaona kifua inakuuma sawa, lakini ni tofauti kabisa, si ile ya kawaida, something different.
Something important that you've mentioned na ring kwa my mind is that sisi kama Africans tuko na very poor health seeking behaviors. Tukiongelea about health seeking behaviors ni ile ambayo maybe you feel a symptom somewhere, then unalenga, una assume symptom. But from whatever that Madam Kanda has said, it is very important that when you feel or you have this clinical manifestation, ni vizuri uende hospitali. Usilenge useme ati nimesikia uchungu kwa moyo then imepotea, unalenga. That could be a very serious indication of this ischemic heart disease, and we've said that it is claiming a lot of lives, and that is why we are here to put out the message to you guys. Feel maybe some symptom of whatever that Madam Kanda said, have good health seeking behavior. Send hospitali, get checked so that the doctor or the practitioner will be able to advise you on the way to take or how you're going to respond to whatever that you are presenting with.
So to add on that one, on your point kusema some people have very poor health seeking behaviors, ukisikia that uchungu, you don't have to like ignore. Uwezi ufai kulenga kabisa. Do you remember coronary artery disease ama ischemic heart disease, ikienda sana it will take a maximum of 10 to 15 minutes. So failure kutokuwa, kama kutakuwa na any form of medical intervention, ukose kwenda kwa na daktari, it can lead to cardiac arrest. Na hiyo cardiac arrest, it's a very 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 bad complication. So ni nzuri uende kwa daktari ukianza kusikia hivyo.
So to our viewers, a take home message: ensure that when you feel or when you find yourself experiencing these symptoms, ensure that you go to the hospital as immediately as possible.
Then to add on that one, chest pain, ukisikia uchungu ambavu haitamaanisha kabisa uko na hiyo heart attack. Kuna vitu mingi kuna ugonjwa nyingi ambayo inaweza kufanya usikie uchungu ambavu. Moja nyingine inaweza kuwa pneumonia. Kuna asthma ambayo itakufanya ukose kupumua vitu ama other diseases. So ukisikia chest pain, si lazima kabisa imaanishe uko na hiyo heart attack. Alafu pia ukisikia hii uchungu yenye kwa tumbo yenye inaitwa epigastric pain, it won't pia necessarily mean uko na that heart attack. It could also mean other things kama hiyo gastritis. So that is why ni important kabisa to seek medical intervention the moment umeanza kufeel vibaya.
Thank you. I hope the message is home and it is loud and clear. Something very important, Madam Kanda. Most of the time waga unapata mtu anaenda hospitali, maybe that person has good health seeking behaviors. Na mtu ameenda hospitali, anaambiwa now this is the procedure that utafanya 1 2 3. I think now because you're a clinical officer and you can basically tell that person wakati unaambiwa maybe go through this test and this test, that is on the aspect of diagnosis. Ningependa you demystify hizo process ambazo mtu anaambiwa ama some of the procedures that somebody undergoes. Ningependa uelezee viewers wetu ni nini or what are some of the diagnostic indications that we have or the diagnostic approaches that we have ambayo inaezesha a clinician kujua that this person has ischemic heart disease.
So we have the diagnosis apart from the hizo symptoms venye wewe unasikia mwili yako iko venye umeambia daktari unasikia hivi na hivi na hivi. There are also kutafanya lab test, alafu kuna an imaging. Nikisema imaging na maanisha ni picha. So lab test tumesema we have what we call the risk factors ama predisposing factors. So tunaweza ona one, we have what we call sugar levels. Tumesema ugonjwa sukari inaweza increase your chance ya kupata coronary artery disease. So hiyo ya kwanza tutaona. And then tutaona pia pressure yako iko aje. Alafu kuna some hormones za roho, what we call cardiac enzymes, zenye huwa tunapima. So pia ukikuja kuna what we call angina, of which it's almost like the same, kuna different types. So the cardiac hormones itatusaidia kujua ni which type of angina. But the most definitive test ni hiyo imaging, what is called electrocardiogram. So itatuonyesha kama kuna shida ama hakuna shida.
Thank you our viewers and wale ambao wako nyumbani. I think leo unaambiwa step by step whatever that happens in the hospital, and that is why it is good that when we have these health talks ama mazungumzo ya afya, tunakuwa na somebody ambaye ako experienced na ako na skills na knowledge in that field, and we have somebody maybe from the clinical nutrition side, so that wakati tunakupatia recommendations on what to do, it becomes information that is multi-pronged, iko very rich information in information, so that ikusaidie wewe kama binadamu, so that you are able to avert these diseases, and if at all you have this disease, you know how to manage it so that it doesn't develop complications. And Madam Kanda, talking of complications, for those individuals ambao maybe the disease is advanced ama they have poor health-seeking behaviors, what are some of the complications that may arise if at all this disease is left unattended to or untreated?
So we have the complications. One of it ni cardiac arrest. So heart attack ita take a bit of like 10 to 15 minutes. Kama kutakuwa na any form of medical intervention, it can lead to your cardiac arrest, and then bado inaweza lead to brain damage and all other forms of organ damage. Juu sasa kama damu haiwezi kafika kwa roho, kumaanisha ama kama damu haiwezi kafika kwa hiyo muscle ya roho, inamaanisha haiwezi kapump damu to all other vital organs. Na tukisema vital organs ni kama kidney ama figo, we have the brain. Now the brain, it is less forgiving. The brain ikikaa for like 3 to 4 minutes without oxygen, inaweza undergo what you call brain death. So you might end up to all other complications. Then we have to, there's really watu wanapatanga ugumu ku differentiate between heart attack na cardiac arrest. So the difference is that cardiac arrest, it is like ni electronic form, so it depends on how like, so ina happen due to what we call arrhythmias. Hiyo inamaanisha like how blood inakuwa pumped. So kukiwa na blood ikiwa pumped in chaotic way, inaleta what we call arrhythmia, so that is cardiac arrest. So it is electrical, but on the heart attack that one is about blood supply to the heart. So that is one of the most common complications.
Yeah, very, very, very detailed and very well said. So, Madam Kanda, from whatever that you've said is that this ischemic heart disease, the complications are like a ripple effect. Inaanza na heart, then it goes on to the other organs. Mm-hmm. So we have such kind of an interplay. So that is on the complications, and moving on next, now we want to focus on the management. If at all you have this disease, what are some of the management practices that you can actually engage in or be put on so that you manage the disease and you don't have the development of complications? And I want to highlight that in the management aspect, we have the pharmacotherapeutic approach and the non-pharmacotherapeutic approach. Kwa pharmacotherapeutic, tunatumia madawa kutibu. Then kwa the non-pharmacotherapeutic, we try to adjust the risk factors, ama zile ambazo zinapelekea mtu kudevelop certain diseases. So, Madam Kanda, because you're a clinical officer, I think it will be wise enough for you to take us through the medical management of this kind of disease.
So before I go to the medical management of coronary artery disease, kama uliwaipata heart attack, there is high chances bado utapata like another heart attack. So the moment so heart attack inakuanga reversible, that is between the 10 to 15, ujapitisha that 10 to 15 minutes, you intervene, and that intervening inamaanisha unampeleka to the nearest healthcare facility. So kama an individual amekuwa na heart attack before na kona some medications, just give to him or her immediately, like kabisa. We have a certain drug called aspirin. That one is a blood thinner. So kama umeevaluate patient kwa na ini heart attack, kama alikuwa na heart attack before and then akapata the second episode of heart attack, kindly give aspirin. But also one factor to note, mtu aki lose consciousness or something like that one, it might also be like other diseases. For example, kama mtu ako na internal bleeding, maybe amebleed kwa tumbo and that ame lose damu mingi kwa tumbo, anaanza kuwa unconscious, we really don't recommend kupeana that aspirin. Aspirin is like a blood thinner. When you give that aspirin, na maybe the patient alikuwa na bleeding will occur more, like itaongezeka kabisa. You'll end up losing a lot of blood, na maybe the next thing unfortunately might be death also. So you really have to evaluate. So one of the drugs that we use ni that aspirin. And then we also have other types of drugs. We have what you call statins. So statins itasaidia ku break lipids na bado itasaidia in weight loss. We have certain drugs called beta blockers. We have calcium channel blockers. So they include those ones.
Yeah, that is a very detailed pharmacotherapeutic approach. Now, moving on to the non-medical approach or the non-pharmacotherapeutic approach, this basically involves the changing or the adjustment of risk factors. So, kama labda haukuwa unafanya mazoezi, it would be wise enough that you start exercising. And from the previous episode, Madam Kanda nilisema like if at all unapata maybe somebody is overweight, it is not advisable that you actually engage that person in exercises that involve jumping and very strenuous activities. It is important that unapeleka patient pole pole. So kama maybe the patient akona kitu kama 80 kgs or 100 and maybe the BMI inatuonesha that this patient ako obese, it is important that we focus on putting into place or starting the exercise pole pole. For example, unamwambia sasa for today, kama anaanza mazoezi, unamwambia you can walk for 45 minutes or 30 minutes. Unaanza kwa kutembea. Then after some time, wakati patient ame lose that huge amount of weight, unaanza kumwambia now you can jog. Because una realize that most of the time, most of the trainers ambao tuko nao kwa gym, anaambia mtu mzito aanze kurukaruka. The effect of this kurukaruka kwa gym na uko na weight kubwa sana ni ina put a lot of pressure on your joints. So unapata you may be wanting or you may be intending to address one issue, then unapata you develop another issue, your joints. So it is very important that wakati tunaanza mazoezi, you start slow. Then after some time wakati una lose weight, you pick momentum to a point whereby sasa kama weight ni manageable, you can engage in those vigorous activities. Another important thing to say on the modifiable risk factors is fixing your diet, ensuring that you avoid these processed foods. The white rice, mambo ya mkate, and there's a discussion somewhere that I came across, mambo ambayo unapata the medical practitioners wanaambia wagonjwa wale mkate brown, wengine wasile mkate white. You realize that the effect that this bread has on the effect that this bread has on the blood sugars is just the same. In a raised blood sugar in the same level, at the same level. So unapata as much as you may be advising an individual, sijui ale mkate ya brown itamsaidia, the results in regards to the detrimental effects are just the same. So it is important that we focus on avoiding these processed foods. Tukule chakula zile ambazo tunapanda kwa shamba na to avoid mambo ya kukula maybe in the hotels, because most of the time unapatanga watu wengi siku hizi sana wanakula in the hotel. So unapata most of the processed foods ziko pale na ziko available cheaply. Another thing is if at all mtu you smoke and you drink alcohol unreservedly, wewe tu ni mlevi all the time, tumesema that this becomes a very important modifiable risk factor that leads to the development of this ischemic heart disease. Therefore, anza pole pole, try to avoid. You can join a rehab pole pole. Najua kuacha ni ngumu sometime, so you should do it under the management of a counselor. Madam Kanda, do you have anything to say on that?
Yeah, labda apart from the non-pharmacologic, we have the pharmacologic, and then we have the surgical intervention. There's something called the surgical intervention can either be invasive ama non-invasive. Kuna moja inaitwa stenting. I'll just mention it that way. So apart from the non-pharmacologic, we have the pharmacologic, now we have the like some surgical intervention. It's see invasive kabisa, and I think you really don't have like you have to make incision kwa the chest, but it's something, it's non-invasive in a way. See kabisa ile surgical kabisa.
Okay, that is nice, and I want us now to move on to the prevention. Kwa mtu ambaye labda tumeongelea mtu ambaye amedevelop the disease already, and what are some of the management protocols ambayo anafaa kuundergo so that we don't develop complications and we don't end up losing a person, a statistic in whatever figures that we've mentioned before. So twende kwa the prevention approaches, and I'm going to start with the lifestyle modification. Kitu ambayo nimesema in the previous seconds or minutes. Number one, ensure that you exercise, ensure that your diet is clean, ensure that you don't engage in consuming these drugs such as smoking and alcohol intake ile kwa wingi sana ambayo haifai. Another important thing ambayo nitaongezea as a scientist ni kukuelezea that we should improve our health seeking behaviors. Sisi kama Africans and maybe kwenye tuko watu wengi huaga wana feel symptoms alafu wanawachilia. So unapata mtu wakati anaenda hospitali ni ile wakati imekuwa mbaya kabisa. We should improve our health seeking behaviors. Kila wakati go for regular tests. It is very important that you go for regular tests hata kama hauna ugonjwa fulani. Just go. For example, enda uangalie levels zako za sukari. I'm sure watu wengi ambao wako nyumbani they have never checked their sugar levels. Enda tuangalie our lipid profiles and the enzymes ambazo madam amesema. Tukue kuwa na this health seeking behavior so that we are able to detect these diseases at an early age. The beauty about these NCDs is wakati una detect this disease at an early age, it becomes very easy to manage and you can get to remission easily. But wakati ime advance, it becomes challenging and the management becomes very intensive and also the cost of management inaenda juu sana. So for our viewers out there, ensure that you go for regular testing, regular diagnosis so that you're able to know whether you have this condition or not. Thank you. Madam Kanda, could you add on that?
I think I've exhausted all that I had.
Okay.
Yeah.
That is impressive. So at this point, I want to welcome our students, if at all they have any questions. Respond to maswali ambayo viewers wetu waliweka kwa page yetu. Now I think it would be wise that we invite our students watueleze some of the questions that may be pressing ama ambayo wanaona ni important kuuliza as a result of this discussion. Where do we start? You introduce yourself and you tell us your name, the course, and your question.
My name is Alex Mwangi, taking a course in diploma in orthopedic and trauma medicine. I'd like to thank you for this opportunity to pose my question, which is, what is the prognosis for a person who has been diagnosed with this disease?
Thank you for that question. I think Madam Kanda, you can handle it. I think it would be important that kwanza ueleze ametaja very technical term prognosis, na viewers wetu pale nyumbani wanaweza kuwa hawajui maana ya prognosis ni nini.
So ukisema prognosis, it simply means like the outcome, ama kama mtu ako na hiyo ugonjwa anaweza kupona ama itaenda kuwa mbaya, like kabisa it leads to something so bad. So with coronary artery disease ama hiyo ischemic heart disease, uki intervene in the first 10 to 15 minutes, there's high chances you can survive. So ischemic heart disease ni reversible. You can make changes into it. But ukipitisha that maybe 20 minutes or so without any form of intervention, it can lead to other complication, which is cardiac arrest. When cardiac arrest, you end up being unconscious and you really can't do anything about that. So I can say it's 50-50 depending on the intervention that you make. Yeah.
And another thing that I would like to add on from whatever that Kanda has said. Kanda, you realize that most of the time unapata patient amekuja hospitali akapata advice ya madaktari, advice ya nutritionist, advice ya whatever medical practitioner ambaye ameattend to him or her. Then unapata patient amepatiwa dawa akaenda nyumbani. Then baada ya muda amerudi kwa zile predisposing risk factors. So unapata most of the time most patients they don't stick to the plan of care that we give them in the hospital. So unapata mtu labda amekuja hospitali with an emergency, then baada ya muda wakati anaona ako sawa, then ana go back to those risk factors, consuming those highly processed foods, kutofanya mazoezi, and also poor weight management and the rest. It is important that wakati umeenda hospitali ukatibiwa, whatever that the doctors and the medical practitioners as well as the nutritionist na anyone ambaye ameattend to you amekueleza, ensure that you stick to that plan of care, because you realize that this kind of diseases, they take a longer time to manage, the NCDs. Therefore, it is important, if you want a good prognosis, as our student has asked, it is important that you stick to the plan of care.
Then I think to add on that point, ukikuwa diagnosed with ischemic heart disease ama coronary artery disease, utakuwa on monitoring for like a period of time. So it's really like a call of action to all doctors to really monitor. And then to educate the patients on the dangers ukiacha kufuatilia on whatever you've been advised to do. Yeah.
And I think that is what we are doing here. We are trying to sensitize you, to educate you, so that we prevent and at our level we try to put out the message to you guys, so that wakati unaanza kudevelop these issues unakuwa na wepesi ukienda hospitali, and you also stick to the management protocols that have been put in place by the medical practitioners. I want another student to ask a question so that we can respond to it.
Thank you. My name is Teresa Jambi, doing perioperative data technology course. My question was, what are the symptoms of coronary artery disease and how do they differ between men and women?
A very important question. The question is the signs and symptoms. So, Madam Kanda, please answer that question.
So they are the same symptoms. We have chest pain, which can radiate ama itatoka kwa mbavu iende to other parts of the body, which is one of them inaweza kwa the arm, another one could be the jaw. Apart from that one, kuna sweating, a lot of sweating, what you call diaphoresis. And then another one utakuwa na dizziness also. And then another one you have utakuwa na difficulty in breathing. So the difference maybe between the male and the female, I think itakuwa on that epigastric pain where like you can really misdiagnose. Unaweza sema ni gastritis, but in real sense imekuwa ikikuja pole pole and ilikuwa ni ischemic heart disease. Yeah.
So from that, our viewers, you've heard the differences in the signs and symptoms, or the clinical signs and symptoms become almost the same. Na differentiate sometime ni iko na very thin line of separation in the differences.
Maybe unaweza sema where the difference come, maybe due to the age factor in terms of gender. Do coronary artery disease, men wanaweza present earlier at around 45 years, and then female will present 10 years later, which is around 55, time washafika menopause and estrogen haiko tena kwa mwili yao, which was like a protective hormone also.
And something important ambayo Madam Kanda mention na ikanikumbusha kitu tena. Talking to her reminds me of a lot of things, or it clicks something in my brain. For the men, watu wengi ambao these days ukitembea huko nje unapata that most of the men wana vitambi wengi sana. You have central adiposity. This central adiposity ambao unapata mtu akona kitambi, mtu anakuambia sasa unakula vizuri, uko healthy. It is the opposite. Unapata kitambi ndo one of the causes ama one of the leading factors that predispose us, especially men, towards developing these non-communicable diseases, and an example is the ischemic heart disease. So kama uko na kitambi, that means unakula chakula kingi kushinda ile ambayo mwili inahitaji. Unafaa upunguze through, unasitumia Ozempic as we've said, because tumesema Ozempic iko na very serious side effects. So ensure that you go through the natural way of losing weight, which is fixing your diet and also exercising day in, day out.
I think anaweza tumia Ozempic kama it has been prescribed by the doctor. So you can just use it under doctor's prescription, but you can't really use it as a lifestyle way of reducing weight.
Yeah.
Just opt for the physical activity way.
Yeah. And that is what we've seen on social media. Watu wengi sana ambao wanataka ku lose weight wanatumia Ozempic as a means or as a tool of losing weight. So if at all uko overweight, anza ku fix your diet, and I think most of the time inakwanga ku fix your diet, because weight is all about diet. Most of the time ukizungumza na wale watu ambao wanafanya mambo ya training na kujaribu kusaidia watu through physical exercise, they tell you that 20% is what happens in the gym. The 80% of losing weight happens in the kitchen. Venye chakula ambayo unakula, how you prepare it, and the ingredients that you use to prepare it determine how you're going to lose weight. Unaweza kuwa unaenda gym, unaruka, unafanya mazoezi yote, but kama hauja fix diet yako, you won't lose the weight that you're holding on. So it is important that as much as una exercise, you supplement it, or fixing your diet becomes a very important management aspect in regards to weight. So wanaume, tafadhali yuko nyumbani, tupunguze vitambi, tufanye mazoezi. I want to move systematically to one of my students atupatie swali lake, then we respond to it.
Thank you. I'm Joy Musioki, pursuing perioperative theater technology. My question is, how does chronic inflammation lead to progression of chronic artery disease?
Thank you. A very good question, and I think this points us to the pathophysiology aspect of the development of this disease. And Madam Kanda, you could take that.
So tulisema about the atherosclerosis, of how like coronary artery disease can come into like somebody to have it. So it starts with destruction of the blood vessel, the artery itself. So kukiwa na destruction, the inflammatory process starts. Na kutakuwa na deposition of many cells. One of it could be what you call the monocytes. Another one, any form of cell, the lipids. And also at the end of it, inaenda ikigrow inakuwa kubwa as time goes. So inaenda kabisa inakuwa kubwa until it completely occludes the coronary artery. So from that one, the coronary artery ikiwa obstructed means like the flow of blood haiwezi fika sasa like to the heart muscle.
From whatever that I've heard, I think that question is adequately answered. Moving on to the next question, I want to hand over the mic to another student.
Thank you. My name is Alan Nekesa, a student of ITech, taking a course on perioperative theater technology. I have a question, which is, how can stress management techniques impact CAD or coronary artery diseases?
Madam Kanda?
Okay, you can start.
So let me take it. This student has asked a very important question. Mambo ya stress, how do they lead to the development of certain non-communicable diseases? And one of the research studies that came out linked stress among women to the development of NCDs such as diabetes and hypertension. And we said that when you talk about NCDs, this one disease could be a risk factor towards the development of another. So mtu akiwa na diabetes tumesema ina bring about inflammation, venye madam amesema. So unapata ukiwa na stress, it becomes like a ripple effect. Unakuwa na stress, it leads to a non-communicable disease, then it leads you to ischemic heart disease. I think I can answer that towards that dimension, that dimension. Madam, could you add anything on that?
Yeah, to add on that one. So kunaweza kuwa na like acute state yenye unakuwa nayo tu for like a short period of time, then it ends. But we have the chronic stress, a very long period of time, maybe 3 months or so. So in such situations, kuna certain hormones called the stress hormones. Stress hormones ikikuwa released, we have examples of them. So ikikuwa released, it will have an effect on the blood pressure. So it tends to increase, itaongeza the blood pressure. So you might end up getting hypertension also. So after that, the hypertension can lead to that one, coronary artery disease. So it per se is not like a causative factor like kabisa, but it can be like a risk factor or a predisposing factor. Yeah.
Very important and well said. So if at all you're going through stress, it is important that you seek help. Na watu wengi huku nje sometime, especially men, unapigwa na stress, unanyamazia, and as you've heard, this becomes a risk factor or a factor that leads towards you developing this kind of NCDs. So with that, I want to wrap it up, unless madam you have something to add on.
No.
Tumalize.
No.
Yeah, so for our viewers, I think to this point, you're well informed and you have knowledge on how to deal if at all you have this disease, or how to prevent it if at all you are a person who has maybe been practicing, or somebody who has been exposed to the risk factors that we've talked about. Wanafunzi wangu, kama kuna kitu zaidi ya hiyo, everything's okay? Sawa. So for the viewers back at home, continue engaging with us through our social platforms. Ulizeni maswali. We are going to answer them in the next episode that is going to follow this. So from UNK Media and African International Technical College, we thank you, and let's keep on engaging. Let's share. Let us put the message out so that at the end of the day, we have a healthy nation. We have a healthy constituent.
See you next time.
See you next time. Good evening, and how are you? My name is Calif Musa, a trained clinical nutritionist, and I welcome you to the homestretch edition of Changing the Tides Against Non-Communicable Diseases. We are honored to be at African International Technical College grounds to bring you this informative episode, which will mark a wrap-up of the series that we've been having in the previous week. I am joined on my right by Madam Kanda, who I will let or give way so that she introduces herself.
Good afternoon. Hello viewers. Welcome to today's episode. My name is Kanda Immaculate Gerono. I am a clinical officer by profession, and you are welcome to this session. I hope you will get something positive out of it. Welcome.
Also to recognize is our students on my right and left side from this institution taking various health courses. And today, in the aspect of changing the tide against these non-communicable diseases, we'll be focusing on ischemic heart disease. But before we get to the detail and further discussion of whatever that we're supposed to handle today, we thank the viewers for their positive contribution and responses in the previous episodes that we have. If you remember, the first episode we talked about diabetes, and in the second episode we talked about hypertension. And there are various questions which arose from that, which I think it is very important that we respond to before we proceed to the next chapter of the discussion. And Madam Kanda, just one of the questions that came up from our viewers was that why are we focused? Good evening, and how are you? My name is Calif Musa, a trained clinical nutritionist, and I welcome you to the homestretch edition of Changing the Tides Against. Good evening, and how are you? My name is Calif Musa, a trained clinical nutritionist, and I welcome